COVID outbreak. And, we know that it's a very challenging time, but also, offering opportunities for us to rethink how we are doing all, our approaches. And I think you have a big opportunity as students, to reimagine the reality and to build another kind of societies. Thank you, over.
Thank you so much for being with us today. Then I'm just gonna leave the chance for Barbara to talk to us a bit about herself, what she does in SCORA IFMSA in her NMO.
Thank you, Hisham. So hello, everybody. My name is Barbara Nyaka. I am the current Nora for Msake, Kenya. I've been an active SCORA Angel since 2017, and I've been Laura before for 2 terms. And this is now my 3rd year as Nora. Now, this is my 3rd year in SCORA. So I've conducted many activities on 4 out of the 5 focus areas in SCORA. Currently, the main thing that I'm doing right now in my NMO is sort of a COVID-19 response to menstrual hygiene management. I'm coordinating it with all my officials in my NMO. And yes, I look forward to sharing about everything that we've been doing and learning from all of you as well. Thank you.
Thank you, Barbara, as well for joining us today. Then, Noor, I should give you the mic to introduce yourself.
Hello, everyone. I hope that you are well and safe. My name is Noor Al-Haidi. I'm a 4th-year medical student at Al-Azhar University, Gaza, Palestine. I'm the current Nora and the first Nora for Palestine since we are full membership. We are full members in IFMSA. I have coordinated many SHRH activity, GBV, only child abuse also. I'm really interested in SCORA focus area. I also have worked on many projects with UNFPA related to SHRH. Also, I have worked on SHRH in COVID-19 times, also with UNFPA. I also been in a Your Hope camp for more than 3 years on breast cancer and how to advocate for breast cancer, how to give support to breast cancer survivors. Thank you for giving me this opportunity to be with you. Nice to meet you, and I hope to enjoy this session with us. Thank you, Hisham.
Thank you, Noor. We're glad to have you with us today. And finally, Cecilia, if you're with us, I'll give you the mic to introduce yourself. Tell us a little bit about the work you do.
Thank you. Hi, everyone. My name is Cecilia Espinosa. I'm a senior advocacy advisor at IPAS. I work on different areas of work in my organization, but I focus on adolescents and youth sexual and reproductive rights and access to safe abortion. And I have lead the IPAS partnership with IFMSA for the last 9 years. So we have done a lot of work together. And I'm excited to be here today to share more about my experience with COVID, but also what IPAS is doing and what we have learned in this last 5 months. Thank you, everyone.
Thank you all for joining us today. And we're all looking forward to strengthen these partnerships and to learn further from each other, especially in these times. Moving on to our first set of questions. So we're going to be having 4 general questions addressed to all of our speakers, and then it will be followed up by a Q&A by the floor. So the first question would be, how do you perceive COVID-19 as SRHR? So how do you think it has impacted HR in the past 5 or 6 months? If you would follow the same order, if Jose would like to start by answering the question.
Maybe if you want, we can move ahead and start with other person.
Okay. Whoever is sure, or whoever is interested in answering.
I can be the first one.
Yes.
This is Cecilia again.
Thank you, Cecilia.
No problem. So there's a lot that we can share about the impact that COVID is having on sexual and reproductive health and rights. But there's definitely we have seen from our experience working in Africa and Asia and Latin America how the mobility restrictions, the growing economic crisis, the how health systems are overcrowded due to the COVID-19 response have definitely affected access to sexual and reproductive health services, including abortion. The disruption that had caused the COVID-19 pandemic has created additional physical, economical, logistical barriers to abortion and other sexual and reproductive health services. But also something that I have been, following up and also working with my colleagues is like the impact that COVID is having on adolescents and youth. We heard a lot in the news and WHO reports and everywhere, like obviously children and youth are being affected even when they're not the main group that is being infected with COVID. We've seen from our work at IPAS and also what other organizations have been documenting is like how adolescents and youth are suffering, from social isolation, from an increase in sexual violence and exploitation. There's a reduced access to services, as I mentioned before. A lot of children and youth also, especially in low-income countries, they receive food and other services through schools. So there are also a lot of food insecurity. Their nutrition has been affected. And we know that there's millions of children and adolescents out of the school. So this is definitely having a huge impact on their life. The one thing that personally concerns me a lot is like how comprehensive sexuality education is being affected because of children and adolescents being out of school. And we know that this, may not be seeing all the impact that this is gonna have in this generation lives, but we're gonna start seeing in maybe a couple of months. Even from some anecdotal reports from my colleagues in working in Malawi or in Bolivia, they are already seeing an increase on unintended pregnancies. And due to the mobility restrictions and lockdowns, a lot of the adolescents, even when they are victims of sexual violence, they're not able to access to abortion services. So even when it is allowed in their country, or they are, they have the right to access to abortion due to rape or incest. So, there's still a lot to be determined in terms of like how governments are, trying to get back to normality, but at the same time controlling the pandemic. So I think that we still have a lot to see in terms of like the impact, but also the long-term consequences that COVID is going to have on SRHR. But definitely, the pandemic has increased the already existing barriers for young people and for women too. So thank you.
Thank you. And thank you also for shedding the light on the fact that CSC could be somehow overlooked in these pandemics, I would say, and having a global or like regional overview of what the situation could be, for example, in the African region. And we could then move on to maybe Noor to talk to us about a more specific overview in her NMO or in her region, or based on the experience that she lived and how the COVID-19 impacted SRHR for her. Thank you, Noor.
Hello, everyone, again. I will talk about SHRH in COVID-19 terms in general and mainly in my NMO. I want to say that all aspects of SHRH has been affected because of this pandemic and this outbreak, because of the limitation restriction, because of there is no movement, because of the planning to advocate and to do more to prevent like child marriage, to prevent the domestic violence, and every planning we have organized to do to improve the situation of SHRH in my animal has been cancelled because of the COVID-19, because of being afraid to get infected. So I want to talk mainly about how the restriction of limitation, how there is no movement, how this is the organization which work on gender-based violence has been affected because of the COVID-19 and the lockdown and the quarantine. Lockdown and the quarantine prevent the NGOs here in Palestine to work and to provide support for the survivors from the who suffering from gender-based violence. Also, found more obstacle to provide the contraceptive, to provide the health materials which needed to for the maternal health, for other things. Also here in the situation in Palestine, we have huge increasing in number of gender-based violence cases, domestic violence, physical, sexual, and emotional. Even where there is a lockdown and quarantine, and there is no people, many people's in streets and etc. It's shocking that there is a increasing number in sexual harassment. I don't know how, but there is happening, honestly. I can say every aspect in SHRH has been affected in a wide range, and this is what I can see, what we can see in our community, and I could not accept how much the long-term effects will be. I read some research here in Palestine about the situation and in the EMR region about what is going on in COVID-19 and how has affected SHRH, gender-based violence, and the plans which has been founded by the NGOs, the UNFPA, other organizations to prevent child marriage and these topics and to improve the situation. All of these planning and these topics plannings has been stopped, which means that we are coming back to we have reached the half of the way, and because of all these things has been done, we go back to in our planning, we stopped advocating and etc. Thank you.
Thank you, Noor, for sharing with us how much the actual pandemic would affect people who are already vulnerable, or like how much it could actually aggravate situations like the movement restrictions that you have in Palestine, or maybe other countries are having the same experience, and the pandemic just made things a lot worse. And these situations are ones that could be overlooked as well, and we need to focus on them. Now, if Barbara wants to share some of her perception as well, coming from Kenya and the African region. Go ahead. Thank you, Barbara.
Thank you, Hisham. So for the impact that COVID has had in SRHR in Kenya, I'll try my best to classify so that I summarize basically the effect holistically in all the focus areas in SCORA. So let me start with the maternal health. This one, I've mostly gotten the statistics from those in the front line, my friends from the front line. We'll start with initially when the lockdown was announced in Kenya, all clinics were closed, from antenatal clinics, postnatal clinics, family planning clinics, comprehensive care clinics, everywhere was closed down. So that resulted in, number one, there was a high increased rate of maternal mortality because women couldn't even go out at night. If they went into labor, they had to stay indoors until morning when the curfew was over to present to hospital. By the time many of them presented to hospital, you found that they either had IUFD, which is intrauterine fetal demise, or they already had so many complications, they ended up dying while giving birth. Another thing was that there were fewer people, even after the lockdown was lifted, which was about, I think, 2 months ago, yes. You found that there were fewer people who are visiting the antenatal and postnatal clinics because people are scared of contracting the virus. So the doctors found it very hard to follow up on the pregnancies, and they couldn't be able to tell which ones are high risk, which ones are low risk, and they couldn't also be able to help out as much. That's for maternal health. Then we go to, in terms of family planning, there's actually a report, like many women asked the doctors to remove the long-term contraceptive methods because they see that this period is like a gap year and they would like to give birth more. And the fact that, and also in addition, in contraceptives, you found that there's actually a, let me call it a shortage. So anyone who'd like access to the contraceptives has been unable to get it because you can't find it anywhere, and there are very few places that are open anyways. Then we go to GBV. There's been about, according to Gender Violence Recovery Center in Kenya, we have about a 21% increase in gender-based violence cases. And even according to them, they said that the number of cases that are reported are similar to those that are reported in post-election, like after elections when there's violence or when it's not the same, it's a bit more than normal. And most cases are domestic violence and child abuse. There's also an increased rate in the number of cases of FGM and early marriages, and this has become prevalent in 22 counties out of the 47 counties in Kenya, which is really depressing. Many girls are being sold off to marriage because maybe the parents lost their source of income, and the only way the parents can get income is if they marry off their daughters. Then we go to period poverty. So of course, with COVID came laying off, people were laid off. So many parents lost jobs. So unfortunately, the situation in many cases in Kenya, especially let's say the urban slums and the rural areas, you find that they either, the parents will actually coerce their children to engage in transactional sex because there's no any other way to like acquire income. So they engage in transactional sex to get money to buy food. And even in households where they can at least get some money for food, there is inadequate resources to cater for the menstrual hygiene products. So the girls have to take part in transactional sex so that they can be able to get money to cater for their menstrual hygiene products, which are very expensive for a majority of the Kenyans. And also there is one particular case in terms of the LGBTQ community. Homophobia and transphobia has greatly increased, especially in the refugee camps in Kenya. I'll give a particular example. There's a camp called Kakuma Refugee Camp. It's in the northwest part of Kenya. There has been increased reports of homophobia where the houses are being burnt down, they are being raped and killed. It's become much worse because the police force, ideally they were now commissioned to enforce the restrictions. So that's happening. People were left unsupervised. And you know, with homophobia, since there are no consequences, unfortunately, many people in this community have been killed, they have been violated, and it's really unfortunate. But that's the situation. However, we are doing our best in our position with other NGOs to do what we can to help this community. So basically, in a nutshell, that's what is happening in Kenya. Yes.
Hisham, you're muted.
You're muted.
We can't.
Sorry. Thank you so much for shedding the light on maternal health issues, especially in the African region in general or in Kenya, and the fact that these problems have already been occurring, but the pandemic just has worsened these situations for these vulnerable populations. And finally, Jose, if you could finish up with the question.
Thank you, Hisham.
Thank you so much.
Yeah, I don't want to repeat, but you know, I think I completely agree with everything that has been said, because it's actually reinforcing what is happening around the world. And UNFPA at the beginning of the year in January launched the results of a modeling exercise of the costing of the three transformative results that UNFPA is trying to achieve around the world, that is related to ending maternal mortality, access to contraceptives, but also ending harmful practices. And based on this costing exercise, in April, UNFPA launched some projections using this same modeling. And in April, UNFPA and other academics were calculating that, if the world continues, having all these lockdown measures and policies in place, as was at the beginning of the pandemic, additional 7 million unintended pregnancies could happen, along with 31 million cases of gender-based violence could occur if, countries continue having lockdown policies during 6 months. And it was expected that for every 3 months that the world, continue uh, having, lockdowns, we can expect additional 15 million cases of gender-based violence. So I know that these, are projections, and we expect that hopefully this is not going to happen, but it's just to reflect, how all these lockdown measures are affecting completely, all the spectrum of SRHR, and, all the intersections that applies, because we can see that, this is related to, the economic situation of families, households, what happened with adolescent girls, staying at home, also with, the perpetrators of violence, what happening, with the lack of, spaces for, sharing with friends, for mental health. So if I need to also, summarize what has been happening, is like, all this confinement is also creating, challenges for mental health. And, the disruption of services is exacerbating all the challenges that were, in place before the pandemic outbreak. Also, we have been, having challenges around the infodemic. Everybody's talking about COVID, everybody's talking about health, but, it's very complex even for young people to really figure out, who is telling me the truth. And, a survey and a study conducted in Latin America by UNICEF and other agencies was showing that actually young people are, feeling more confident about the information that is coming from radios, that is, a traditional means, that, everything that they are reading or reviewing on social media, because they know that everything, can be just misleading. With the change of priorities around the world, we have seen that, even if in general the situation around SRHR is challenging, because, we have also conservative policies around the world, these challenges now are exacerbated. And if often, the policies are overlooking young people, now with the COVID pandemic, even, the policy work is, mostly stopped. You don't have access to parliamentarians, you don't have access necessarily to the government, so everything has changed. And, another thing is like ASRHR services often are not recognized as essential services, so are not part even of the socioeconomic measures of, the recovery stimulus at the country level. And we also need to reflect that, with all the interlinkages, understanding health and ASRHR as part of a complex and systemic net of or web of power relations, we have to consider that also democracy and some human rights are, at the highest risk right now. And especially for human rights defenders, we, are young people working on youth peace and security are facing more challenges. Um, so the role of young people also, we have to be very clear, even if we have been promoting a positive role of young people, we have been also, facing challenges in, how the initial messaging around that young people were not necessarily so affected by COVID created, a sense that they didn't, uh, to be taking all the measure to take care of themselves. And we have seen, the result, around the world. That I'm not saying that this is the fault of young people, it's just part of, how the evolution of the pandemic had happened. And, also, we have to consider all the gender elements around the pandemic, how young people and especially, adolescent girls and young women are also having, an overburden of care and, household chores that are, often invisible. So I think, it's like, and we also have to be, very clear that even for us and all the people working, even, if it's a community level or, national level, this is very challenging because you have to respond to something that you didn't, necessarily have the capacity before. So, shifting all the programming to remote learning, that not all the countries have, the conditions in place to really advance with distance education. And also, with remote services on GVB, telemedicine, and etc. And we needed to react, like immediately, but not necessarily having, the whole picture or on what's going on and etc. So I will stop here. Over.
Thank you so much for sharing your perspective with us. And I think it was very important when talking about youth in what you just shared with us is the fact that the numbers that they see, as much as they reflect the current situation, they cannot perhaps be believable from their part because of the source. And I think it's also on us as advocates for SRHR to try to reach out to them and to try to be as reliable as sources as possible through other medias of communication, not just the radio or other online platforms. Unfortunately, for the policy work that is on hold right now because people are seeing it as less of a priority, it's something that youth as well could contribute to. And yeah, I think it's not much of their fault, as you mentioned, but we as youth and everyone can just do more, and it's never enough when it comes to SRHR. Thank you all for sharing your opinion and your perspectives with us. Moving on to the second question. So in your countries or in your region, was there any specific responses from the government or any NGOs addressing specific SRHR services that were affected due to the pandemic? So anything that was done specifically related to SRHR? So for this time, if the Noras want to start, Barbara, if you want to start with this question.
Can Noor start before me, please?
I'm sorry?
Can Noor start before me?
Yeah, Noor.
Yes, okay, I can. So
you can take a couple of minutes to think. It's fine.
what?
You can take a couple of minutes to think the question over if you want.
I want to say because we have worked on this topic and we have advocated for this topic and we work with the government about this topic. So here, mainly in Palestine, we work on GBV and maternal health and contraceptive family planning. This is the main topics of SHRH here. We work in Palestine. For GBV, UNFPA and other NGOs like YP, etc., have provided hotlines and emergency services for the survivor from GBV or for the who are suffering from violence in their houses, and they founded the shelters and safe houses for these who could live in their homes because of they are suffering from gender-based violence. This is what is related for gender-based violence. We have separated hotlines, one for the West Bank and another one for Gaza. We have published it on the publics, on our PMSA group pages, and we announced for all population in Palestine that we have hotline services for your support. You can talk with us if you are suffering from any type of violence. For maternal health and contraceptive and family planning, etc., our primary health care does not close because of the COVID-19 lockdown. They tried to put strategy to make they working to provide the contraceptive and the needed material for the maternal health. Even the primary health care for the pregnant women, they still working even in the lockdown and specific strategy to prevent the shortage and the contraceptive on the maternal health devices, on the vaccination for the children, for the babies. We have here vaccination, which is funded by WHO, here in Palestine because we are refugees. This program has not stopped because of lockdown and quarantine time. So this is mainly and briefly, GBV services does not stop even in the lockdown, and maternal health services and also does not stop because of the lockdown. Just
Thank you, Noor, for sharing with us your amazing work, especially including refugees in your approach to the pandemic. Barbara, are you ready or?
Yes, I'm ready.
Thank you.
Okay, so for Kenya, so far, let me start with Beyond Zero campaign. It's an initiative by Kenya's First Lady. It mostly focuses on maternal health. So what Beyond Zero has been doing, they've so far trained almost 100,000 community health workers, yes, that are supposed to be first respondents. They've gone out to marginalized areas and areas where the hospitals are inaccessible, especially because of COVID and travel has been banned. They go out and they assist in the women giving birth, and they've been training people also on proper postpartum care. Beyond Zero also has an initiative for the youth. They've been organizing, an event where it's supposed to promote the positive values of HIV and AIDS prevention and how to cope with mental health during this pandemic, and also a bit on CSC education. It's all sponsored by the First Lady. So that's for Beyond Zero. Then we have Reproductive Health Network Kenya. We've been working closely with Reproductive Health Network Kenya, and they've been doing a lot of work. For starters, they've been having press releases concerning provision of proper quality youth-friendly services care, if I may say so. And they've also teamed up with Marie Stopes in Kenya. They are actually distributing contraceptives in all the clinics, both government and private, throughout the country because they have a workforce that is vast. Then we've been collaborating with them in online Twitter chats, WhatsApp chats, webinars, trainings. They've been doing a lot, especially focused on the safe abortion and maternal health and contraceptives. We've also been doing a lot of CSC programs with Family Health Options Kenya. They're a member of IPPF. So they've been engaging a lot of the youth online, teaching them about cyberbullying, about how to deal with GBV, how to identify it, what happens if you know the aggressors. And they've also provided hotlines in the event. And then last but not least, the one that we have been focusing on mostly is for the period poverty. We've been combating it. I have officials spread across about 10 counties in Kenya, and we've all been organizing to do community outreach in partnership with Freedom for Girls, a UK-based organization. So they've been giving us reusable pads. We have also been collaborating with Zana Africa, who have amazing, they have comics, youth-friendly comics that are very elaborate on how to deal with COVID-19 and how to manage MHA management during COVID-19. It's even been translated to local languages. It's amazing. And they also, so we've been doing MHM education at the same time providing the materials. So my officials and I have been able to do outreaches. So far, we've done 4 since COVID began. 3 more are still being planned, and we continue to do it because we have the support of all these organizations. Yes, in a nutshell, that's what we've been doing.
Thank you so much, Barbara. And it's really great what you've been doing, touching up so many topics related to SRHR and trying at the same time to focus on regional priorities. And I'm happy to see there's so much collaboration with the government, with the officials, with the press, and it's just a reflection on how much youth can do, even on their own and hands in hands with the government to achieve such great success. So I'm really happy to see that you've been doing so great. Now, Jose, if you would like to go third and elaborate a bit on the specific responses that the NGO you work for has been addressing, or maybe other governmental institutions.
Yes, thank you. Well, as a global organization, we're working in more than 150 countries, and every context is different. But immediately with the outbreak of the pandemic, UNFPA started also providing immediate guidance to country offices to support how the programming could be shifted to respond to the new reality, and also to be responsive in terms of sexual and reproductive health and rights. And we know that and also reflecting that young people need to be taken into account. So we provided guidance. We put together a series of guidance for country offices. Actually, there is a document that is called not on pause, because it's also calling to recognize that adolescents and youth are heterogeneous, that they are living their sexuality, that periods as you said, Barbara, don't stop during the the lockdowns and etc. And I can tell different examples of countries. For instance, in Sierra Leone, UNFPA country office is working with the government and also with implementing partners from civil society organizations to to transform all this text messaging along with radio broadcasting, and providing information not only about COVID but preventing also violence, and referrals to services. Telemedicine and remote services are now in place in terms not only for health, as you mentioned also, Barbara, all this need for antenatal care for pregnant women. With the disruption, there is a high risk of pregnant women, including young women who are pregnant, for not being attending the antenatal care. So everything that is happening around right now, also all the programs working with young people on education, transforming all the messaging for out of school, using not only digital platforms, because we also have to be aware that there is a digital divide, especially for Africa. And we don't we can't think all the strategies or adaptive strategies to be really using social media or the technology using internet. So also that we put together another guidance that is beyond the classroom, for supporting country offices to think how comprehensive sexuality education could be implemented out of school, but also using different means. Also having a conversation with our country office in Sierra Leone, they were saying that they are going to partner even with taxi drivers and other means to really make sure that the message is reaching populations and girls particularly. Even to think about how we are spreading messages using the radio, it's a challenge. Our country offices is even supporting mentors, young mentors, and adolescent girls directly with batteries, because in some spaces there is no electricity. So we can see all the complexities, but at the same time we have seen a lot of creativity in the way that countries, as you mentioned, that are doing in Palestine or Kenya, are also transforming the way to participate and to raise their voices. We have seen like how young people is really engaging in risk communication, and also supporting elders or other people in need. So all our programming are turning to really make feasible that we are not overlooking young people during this pandemic. Another example is some countries are just along the process of reopening, are also working immediately to make sure that all the economic measures or stimulus are taken into account young people, because we know that also previous the pandemic, young people have problems and challenges to access to decent employment. But now this is worsened. So how are we making sure that we have this holistic approach? Menstrual health management is a key element that we have to be very aware. And also the role of midwives, because all the work of UNFPA working on maternal health is also supporting midwives who are part of the frontline workers, but often not necessarily recognized. So I think there is a bunch of country offices that are doing different adaptive strategies, but I would say that, you know, it's sustaining everything what UNFPA does, but just shifting now, and also, you know, taking care even of the political context where, you know, sustaining the investments, and also, you know, the accountability and human rights worldwide. Over.
Thank you so much for sharing with us. And it's great to see that even at these times, we're still making new partnerships and to see this amazing shift into telemedicine, as you have mentioned, and taking advantage of these technological advances that we're having as a human race. And the fact that this way we have managed to, or the UNFPA has managed to reach a lot of people and to raise more awareness thanks to this, to these means of communication. Finally, we will close this question with Cecilia. I'll leave you the mic to elaborate more on the work that you have been doing. Thank you.
Thank you very much. And I also want to repeat what others have shared, but similarly, IPAS is also using different strategies to make sure that you know, the women and youth that we work with have access to information and education, and also reproductive health services, especially focused on abortion and contraception. And we are using different strategies, and you know, obviously listening to others, I was like seeing the similarities and also some differences. One of the things that we have been doing in different countries is also helping health workers, medical staff, and community health workers to get access to personal protective equipment. We have seen how this is crucial to ensure that women and youth especially have access to services because of the fear of COVID. This can create additional barriers for women and youth, but also for the healthcare providers in terms of like making sure that they feel safe to continue with this work. We also have been working with Minister of Health to ensure access to contraceptive and also to safe abortion supplies, including misoprostol and mifepristone. We want to make sure that obviously there's no a shortage of these drugs in the health system. An important strategy that IPAS is using is also to make sure that abortion services are outside of hospitals and in primary care facilities. Because of COVID-19 response happening at the tertiary level, we want to make sure that women and girls have access to the services they need, and considering that you know, using the WHO recommendations of tax shifting, we want to make sure that also mid-level providers are trained to provide safe services. The other strategy obviously have been the use of telemedicine. This obviously looks differently in different countries depending on the legal restrictions or the opportunities that exist to provide telemedicine. And obviously an important element has been working with our community partners, especially young leaders, to make sure that adolescents and youth have access to information. With the mobility restrictions, with the lockdowns, with and other policies that have been put in place due to COVID-19, everything has changed. You probably no longer go to schools. You don't know if the service is open. There's not a lot of information. So making sure that young people have information is crucial. Due to our work, we work with different community members, with religious leaders, with you know, different community health workers and CBOs. So We have been connected with them in different ways. You know, in some countries, for example, I was just thinking in Malawi, there's a limitation of 10 people for meetings. So this have obviously create additional challenges to do our work, but this is something that we have been doing, you know, having meetings in open areas and but also using radios and social media to connect with women and young people. The other thing that has been important for our work is also documenting the impact of COVID-19 in reproductive health services and abortion. Recently, IPAS conducted the IPAS Development Foundation in India conducted a study about the impact of COVID in India, and you know they identify, for example, that with the national lockdown, about 1.8 million women where their access to abortion was compromised. So, you know, we are documenting the impact of the lockdowns and other measures due to COVID in the work that we do. And we are planning, obviously, use this information to for our advocacy and our work with decision makers in the countries where IPAS works. So thank you.
Thank you so much. And it's really great to see how much we can adapt from the situation itself to different regions, to different stakeholders, and the way we engage with them. And it's great that you touched upon documentation, because even though, as it was mentioned earlier, some policy documents or the advocacy work has been delayed or is being delayed, it's good to learn from this experience and to document everything, so we can, as youth and as organizations, move forward and try to change the certain situations or the ugly side that COVID-19 has, well, basically proved to all of us, and try to change the policies and try to change anything that is now working so much regarding SRHR. Thank you all for taking part in the first round of questions. The third one would be, from your perspective, how do you think the media coverage of SRHR matters was during the COVID-19 outbreak? So basically, was it something that was talked about enough or not in the media, perhaps in your countries or in your regions? I'll leave this one for whoever wants to start first, because it's the last question of the first round.
I can start now.
Okay.
Well, you know, I don't have data or evidence to really, you know, back what I'm going to say, but, you know, from my perspective, at least, you know, in terms of observation, is like, there is not so much, you know, coverage in terms of, you know, reflecting what is happening. And I think, you know, also activists and organizations working on SRHR has been, you know, working to really reflect what is going on, because, you know, with all this global health, you know, pandemic and emergency is, you know, not necessarily, you know, reflecting all the breaking down elements or challenges related to health as a whole. So I think, you know, for instance, when UNFPA actually launched these numbers and projections, because, you know, being aware that, you know, with this global pandemic, all the conversation was about COVID, and, you know, also in some cases forgetting that, you know, we have a long list of issues or health issues that need to be also, you know, cared during the pandemic, and also, you know, to sustain equality, to sustain, you know, all the advances that we have been doing along the way, and also, you know, how we can talk about, you know, achieving the SDGs, for instance, or, you know, these global goals, if we are, you know, not necessarily taking care of all the advancements and achievements that we have been, you know, doing along decades. So, you know, and I would like to echo, you know, what Cecilia was saying about, you know, we don't know necessarily now about the long-term impact. and that's why, you know, and just having a conversation with an advocate from Guatemala, who is, you know, a very vocal person working with parliamentarians. She was saying, you know, now it's very complex to have a conversation about SRHR, even if you are showing the numbers of adolescent girls, you know, pregnant, or, you know, even talking about child marriage, because it's, you know, like people is really concerned about COVID and, you know, the economic measures and, you know, the recovery and the lockdowns. And so I think there is a challenge to really make sure that the conversation is not blind about, you know, all or related to body and sexual rights. That's my perspective, but, you know, I need to reinforce that I don't have data to really support this, you know, reflection, but, you know, at least on, you know, what I have seen, this is my reflection so far.
Thank you, Jose, for sharing with us your overview. Cecilia, if you would like to share with us your opinion or what you have encountered in terms of media coverage.
Yeah, so similar to what I was saying, I think I don't have data to support this, but I'm from Nicaragua. I live in the United States, and I follow every day the news from Nicaragua because obviously it's my country. But I definitely haven't seen a lot of coverage in terms of like sexual and reproductive health and rights. Some of the news has been around the impact of COVID-19 on adolescent pregnancy. And I think it's obviously as a result of the work that different organizations do in the country with children and youth in the area of gender-based violence. And also in some way the impact that the schools closing, the school closings are having on children and adolescents. But I won't say that necessarily we haven't had a comprehensive coverage of the news. I live in the United States, as I mentioned before, and I surprisingly have seen some coverage on, especially on the topics that I follow the most, that is like the access to abortion and contraception, especially highlighting the different initiatives that the departments of health and also different NGOs have taken to ensure access to contraception and abortion using telemedicine. For example, facilitating online prescriptions for contraception, or even providing medical abortion using telemedicine. So that has been something I have seen in US media about how COVID has transformed in some way the reproductive health services in the US. One thing that I think is important to mention, it is the how this is going to change reproductive health services in the future. And I think that something that is going to happen after COVID, I think it's like we're definitely going to see more telemedicine, not only for reproductive health, but also for maternal health. And there's definitely good things from this, but also we have to be aware of the impact that this may have, especially in terms of like confidentiality. This is like one of the things that is usually highlighted as one of the good things of using telemedicine, but we know for adolescents and youth, when you live with your parents or with your family, you don't necessarily have the confidentiality or the privacy that you need to access to reproductive health information or sexual health information over the phone or in your computer when you're in a family household. Also, just thinking in the US reality, young adults are, for example, a third of young adults in the US don't have access to health insurance. So accessing to telemedicine without a health insurance in the US, it can be very expensive for young people. Obviously, social media and information using a chat box or any other online platform, it can be a good way of accessing to information. So I'm sure that we're going to see more of this in the media, and also with the work that obviously different organizations are doing to ensure that people have information and access to services that they're definitely essential during this pandemic. Yeah. Thank you.
Hisham, you're muted. Oh my
Sorry.
God.
Thank you so much for sharing with us your perspective from your own home country and where you live currently in the US. Barbara, if you'd like to go next regarding the media coverage in your country or maybe in the region.
Okay, I'll go. So in my perspective, the main SRHR issues that have been brought up in the media, I would say they have done their best, and at least they've covered the issues that really affect like the social issues. For example, at least I've seen a bit on the early marriages issue, on the teenage pregnancies. I've seen a lot also about the GBV. I've seen interviews and debates on media, radio stations. The print media is also covering a lot on what the various NGOs are doing, their initiatives, all the efforts that are being done by very many organizations to combat the SRHR issues. And I can say for unsafe abortion, because it's a very hot topic in our country, it's been covered very well because a lot of people were arguing about it. And of course, when it comes to such contentious issues, there has to be both sides. So the media made sure that that was covered very well. So I would say that at least people realized that COVID didn't just affect other aspects, it also really affected reproductive health. And it also made, generally, I asked a few of my friends who are not exactly medical students, and they said that it has affected SRHR and it's made them realize, like the media coverage has made them realize that, oh my goodness, SRHR is essential. They should have considered this in the COVID-19 response. So it's not so much, but at least it's enough. It's done something and it's made an impact, as little as it has been. Yes, that's my perspective.
Thank you, Barbara, for sharing with us all the way from Kenya. And finally, we finish up with Noor, if you'd like to share with us.
Hi again. Regarding guest has been given opportunity to be highlighted here in Palestine because it's COVID-19 situation, and SHRH gave us the opportunity to start initiative with the PMRS, UNFPA, the Ministry of Health here in Palestine to spread knowledge and awareness mainly about gender-based violence, because we have a huge number of honor killing, domestic violence, sexual violence. So it gave us the opportunity, but it's not as big this big opportunity because all the support has been shifted from SHRH to COVID-19 in awareness and knowledge and fund. Everything has been shifted from SHRH to COVID-19. Also, here in Palestine, they highlighted access to safe abortion, not that much, but they highlighted contraceptive family planning, because we have the number of population here in Palestine is so high, and there is no control in the number of birth, and the economic situation here in Palestine is not that much. So SHRH has been highlighted, mainly GBV, because it's the most important. I wish there is more work and more things have been done on SHRH here in Palestine, but we have a kind of problems like social problems, kind of double, but this is for me. Thank you.
Thank you so much, Noor. And it's good to see how much the response from the media has been different from one country or one region to another in regard to SRHR. But I think we can all agree on how important it is, especially to reach youth. Now we're just gonna go through a Q&A. Someone talking? Now we would go through a Q&A. So if anyone from the floor,
I think some mics are open.
So if anyone from the floor has a question, they can either type it down or unmute themselves and go ahead.
I want to add something. You can.
Yes, yes.
I want to mention just something that using the youth power and advocacy power. When we started to work with UNFPA and PMRS and YPA and family planning, we have reached more than 50% of the rural area in Palestine by social media, by sharing posts and etc. And we designed some like urgent guidelines and hotlines for gender-based violence survivors and urgent maternal health services, and this has bring to us a good impact and changed something. We have received many phone calls related to this topic. They ask for help. They ask to provide the menstrual hygiene stuff and etc. Just this is what I want to mention.
You are muted.
I'm muted, Hisham, again. You are muted, Hisham.
I have this habit of muting myself. It's fine. I said it's great to see the vast impact that you've had in your NMO. So thank you again for sharing. For the Q&A, with a raise of hands for those who want to go, it's down there. So you may just click on that if you have any questions. So we have Emira, who's the Nora in Algeria. If you'd like to unmute yourself or type down the question if you want.
Okay, hello everyone. And before asking the question, I would like to thank our speakers for their amazing insights and inspiring initiatives. Also the IT for facilitating all this and making it possible. So for the question is, like we've already said that COVID has highlighted and showed how much us our HR services are needed and are often looked off. And right now the talk is hotter than ever. So how can we maintain this momentum beyond the pandemic and after, I mean, when people start forgetting about it, what are some solutions or things that we can do to maintain this momentum and improve SRHR services in perhaps the second wave of the pandemic, if unfortunately it happens, and afterwards? Thank you so much.
Thank you for your question. Okay.
I can share a little bit about my thinking about this. So this is a great question, and I think it's a very important one because obviously there's a lot that we need to do. It is not just about what do we do during the pandemic. It is like we still don't really know what is next, or all. As I said before, it's like the consequences, the unintended consequences of the pandemic, and also how the barriers can increase due to the impact of COVID-19. One thing I think it's very important for the work that we all do, it is to document the impact, but also to collect evidence about the different strategies that are being implemented and see if they work or not during this time of crisis. I think evidence is very important for the work that we do. We are using different strategies to make sure that people have access to information. We know that different people have different needs. So multiple strategies are needed and are very important to ensure access to information, education, and services. So we definitely need to learn from this crisis and also from past crises, and ensure that we use that information to advocate for improving the access and use of reproductive health services. I think that we are gonna see obviously different consequences happening. So it is very important that we use that evidence to ensure access, and also to ensure that the limited resources available are well used, and to make sure actually that young people and people in general can also improve access to services and can make their own decisions when they need to. It doesn't matter the context. Thank you.
Thank you, Cecilia, for taking up this question. Who has another question they would like to ask by a raise of hands? Or they can just, yes?
Since I have a question, but I think I can't raise my hand because I'm co-hosting. But anyways, thank you to all the speakers for this really thought-provoking discussion so far. My question is, I think, mainly for Jose and Cecilia. We've been working with members this term, and especially since the COVID-19 pandemic started, and they have had a lot of trouble with their activities being canceled and all that. So there has been quite a long discussion about how they can convert their activities on a digital platform, on a digital space. And I had this point being made at some point in the discussion about bringing everything to a digital space. So my question would be, what advice would you give to our members about moving the activities on a digital platform, and if there are any limitations, for example, when considering comprehensive sexuality education programs and how they are mostly based on real life interaction, how and if they can be moved to a digital platform? Thank you.
Thank you, Christos, for your question. Jose, if you'd like to answer.
Yeah, I can take that one with pleasure. Well, thank you for your questions. I would like also to say that, from the previous question around, how we can maintain the momentum, even if we have, I think this pandemic is showing that we need to be prepared for, to respond when, some humanitarian crisis is, hitting. Because usually, countries that are, living in humanitarian contexts are, more often to, more flexible and, even considering in advance that you need to be prepared, right? With different scenarios and etc. But this is showing, that the entire world should be prepared to respond, and it's changing everything, even the daily basis life. So, and this is also impacting, CSC and other programs as well. But, if we really want to maintain and sustain, this momentum, as you said, Amira, is, we need to consider that, if always, the role of advocates and, young people as activists is crucial, for having, the finger there sustaining the cause, and also, remembering that investments, policies, programs are needed. Now is, also important because, all the countries or most of the countries are taking measures for recovery, or, investments in terms of, are doing situational reports and socioeconomic assessments and etc. So it's very important how our young people can be close to these conversations to really make sure that, all these recovery measures, stimulus, and etc. are also reaching young people and considering, their particular needs, including SRHR ones. And, in terms of, moving to the digital space, even before the pandemic outbreak, we have been discussing about, what happened with CSC on the digital space. And, recently it was, you know, a big meeting in Europe around this conversation, because we know that for CSC particularly, we need, you know, interaction, and we need connection, and we need people, you know, doing participatory elements to really, you know, integrate and do introspection about, you know, the content and decision making and gaining skills. But we know also that education is a whole process that goes beyond the digital space and goes beyond the classroom, and goes beyond also, you know, the spaces or sessions that we are conducting. We are interacting with media, with social media, with conversations, with social norms. So it's a part of, you know, a holistic approach. I can share with you that the guidance we are offering to our country offices during this pandemic is, you know, sustain the program. Please adapt your strategies, but sustain the program. So that means that if you are having, you know, a mentorship program, maybe you are not able now to have, you know, like 12 months program, or, you know, like twice a week having your session regularly, but maybe you will, you know, reduce to 7 months, or, you know, how you can adapt. But, you know, the most important thing is how you can sustain the processes, and, you know, how we also can be creative. We have experience, for instance, working in some countries where they have, you know, learning distant programs using radio. They usually are, you know, having classes of CSC using the radio and complementing with, you know, little spaces in groups at the community level to have, you know, other kind of conversations. So I think the digital space or other technologies are not going to replace the, you know, the human interaction, but we cannot be, you know, just stop because this is happening. It's how we can, you know, reinvent and reimagine what we can do, and being aware that at some point we are going to resume, you know, this social interaction, or also, you know, how we can connect and create other kind of connections we are doing right now. And of course, it's not the same of having, you know, a personal hug or, you know, this personal feedback, but we are not stopping the conversation. So I think, you know, and also how we can maintain, you know, a pedagogy of hope along what we are doing, in terms of, you know, the worst thing that could happen is, you know, that this pandemic is really, you know, disrupting everything, and also, you know, reducing our capacity to build, you know, another society with sexual rights for all. Over.
Thank you so much, Jose, for taking on this question. And thank you, Cecilia, for sharing with us, everyone. Cecilia, do you have something you would like to add as to answer the question that is sent?
Yes, because I think that this is a challenge that everyone is facing right now. I think that I agree with Jose that a lot has been done in the past decade, I will say, to improve access or to create sexuality education in digital spaces using different platforms, you know, apps and websites, using social media, creating programs with a Minister of Education, or NGOs have their own platforms and programs. And there's a lot of like new technology that can be used to ensure access to CSC using the digital space. But there is a huge gap, especially in low-income countries, to access to internet and also access to technology. So this is also something that we should not forget about, because these are the young people who need the most information and support. And this is why we have to have in mind that digital, you know, the digital space, it is important. We need to continue to invest in it. We need to continue creating these resources and tools. But the best way to ensure access to information and education and services to young people is to work with young people. and adolescents. And in this case, with IFMSA, work with the members of your national or local association, so you can find what are the best mechanisms to provide information, to provide education on sexuality and reproduction. So you can find what are like the best channels for them. You know, it may be WhatsApp, and how can you share resources that exist, or you know, to or even make sure that your peers can ask questions about abortion or about contraception, or even to support them in their mental health. So I think that we had to be creative. I think that we had to know that obviously maybe the ideal that we have is that young people are going to have sexual education since age 5 and through the primary and secondary school, that they're going to have access to services, etc., the counseling and other support. But we know that this is not the reality today, and it may not be the reality tomorrow. So we need to continue to identify what are like the best ways that with the resources that we have, and with considering the different contexts, to create and adapt different tools to make sure that young people will have access to information. And an important thing also is to consider how social and cultural norms affect the access to cell phones or other technologies, especially for girls, because there is a lot of research around like how there is even stigma around the use of cell phones for adolescent girls. What is like the ideas that some family members or will have about like seeing a 12-year-old or a 13-year-old, you know, using social media or accessing to information through their phone. So we need to also have that information in mind, and see, depending on the community, depending on the group and the age group, etc., what are like the best channels to provide information and adapt. There are different tools. Like, for example, 2 years ago, I'm sure most of you are familiar with this, but the UNESCO and other UN agencies published the review technical guidance on CSC. So this document includes all the evidence base needed to create, adapt, and design programs that are comprehensive on sexuality education. So I invite you all to review these resources. I can also share the link in the chat box, and just see how you can use these tools also to create your own programs and platforms. I think that sometimes even if you have access and your friends to, you know, do Zoom calls or Facebook calls or WhatsApp, there can be even discussions, just talking to each other about these issues, reading some articles. It can help to clarify some of the existing questions too. Thank you.
Thank you so much, Cecilia, for sharing these resources with us and this information with us. Unfortunately, we will not have time for another question, but we do have another round of Q&A at the end. And we are going a bit over time, so I'm apologizing a bit ahead. So we will go now for the second round of personalized questions. And the first round is for Cecilia, actually. So I don't know if is the screen shared, Lalu?
I'm doing so. It's not
okay.
a bit
okay, so,
depends on my internet speed.
Cecilia, how do you think this new scenario impacted your work as an organization and as an individual, as an advocate? And how did you manage to adapt your work during the pandemic? And it's something you already talked about earlier, so if you want to elaborate on that again, it would be good. And what is the situation regarding access to safe abortion looking like at the moment? And finally, is there any experience, case, or story that you will not forget that happened during the past period, during the pandemic?
Thank you. I hope people don't get tired of hearing from me. But I think that yeah, so definitely there's a lot of that my work has been impacted. Some of my work is actually promoting partnerships at IPAS. Also, I work on international advocacy at the UN. So a lot of the meetings and spaces that I work has been canceled, postponed because of COVID. So as you all were saying, this also creates barriers in our access to different decision makers and how we can advocate to ensure access to abortion. I also have seen this happening with my colleagues working in different countries. At the personal level, obviously, as a woman, this create additional, I will say problems or impact or life in general because of family and other working from home. Even when it's also a privilege, at the same time it create other type of consequences. But I think that one thing it is important to have in mind is that it has helped us to regroup and also think about like how can we better navigate this context and to be creative also in the way that we conduct our work. A lot of the work that I supposed to do in person also is online. So it has taken a lot of my time to rethink how we can repackage and redesign the sessions or meetings or trainings that we were supposed to conduct online, and ensuring access, for example, for participants, that before that we will maybe invite everyone to have a meeting and I will travel to conduct a training or a session. So that definitely brings learning too and all this work. I'm trying to think on a specific story, but I don't know. I think that I have been working very closely with different partners, including IFMSA, to make sure that we readapt in these times, in considering the challenges that exist with limited funding, with travel restrictions. I'm just thinking how I had to cancel my participation in the last GA in March because of travel restrictions and concern due to COVID. So I think I'm gonna stop here, but we're definitely learning a lot. I think that in times of crisis are in some way a good opportunity for learning and to I think that something I will recommend to everyone is, even when we are supposed to be social distancing, let's use the resources that we have to connect with others, so we can also collaborate and work together in what we care most of. Yeah, thank you.
Thank you, and we're more than happy to having you in the August meeting that we're having online. Hopefully we will have other opportunities to make it up for the March meeting, and it's always a pleasure to have you talking with us. Noor, if you'd like to go next. So do you feel that the pandemic has accentuated GBV cases in the world in general, maybe your region or country in particular? And what initiatives do you think governments and NGOs could or should take to help GBV victims and reduce this phenomena? I know you talked a bit about what you've been doing, but what could the next step be? How can they step it up?
Okay, hi everyone again. For sure, every one of us has experienced COVID-19 quarantine and lockdown. And if you ask yourself how have you felt in these times, your answer may be stress, uncertainty, future, financial insecurity, spending more time at home, and also to important that not every one of you has experienced these feelings at the same level. There is a vulnerable population which, such as elderly, refugees, which has affected more than you of these kind of emotions and feelings. So let's imagine together if a person is suffering from GBV in his home, and because of the lockdown and the quarantine, he should spend more time in his house, and there is a reduction in seeking services. How things will be for sure, things will be worse. So COVID-19 has affected in a huge way on gender-based violence, and data has shown that there is a significant increase in number of cases of domestic violence. In addition, there is not only increasing in number, also there is reduction in seeking services which support victims or give help to GBV who is suffering from GBV. So the number of GBV cases is increasing. Also, on the other hand, the services has reduced. Every 3 months of lockdown is lockdown give an additional 15 million cases of GBV. So from March to August, there is more than 5 a month. So each 3 months, there is 15 million cases of gender-based violence. You can imagine how much COVID-19 affected gender-based violence. Also, sexual harassment, as I said, even the streets are empty, lockdown, quarantine, no one goes out. Sexual harassment cases has been increased. Also, there is another result of lockdown, increasing the usage of online platforms. So the usage of online platform has been increased, and the cyber sex has been increased, such as sex trolling, stalking, grooming, and to sexual exploitation. Also, from the aspects of COVID-19 is social distancing. Social distancing has affected on the intervention to tackle a child marriage. Affected the government work, affected us as a youth work to prevent or to tackle this problem, which is child marriage. Each year, delay in tackling this problem increased in 13 million cases of child marriage. So the numbers and the statistics are scary. Also, I will talk about increasing COVID-19. Can ask yourself why sex is increasing in COVID-19 time, but the answer will be because of less control by authorities and decrease in income. Lockdown has affected our economic situation, our incomes, and so the second question I should answer about it. I said that our government here in Palestine work on it. The government should do expand the helplines and the information sharing via social media, via radio, via distributing like guidelines for gender-based violence services and hotlines. Also, the government should increase the access to the services and find shelter and safe accommodation for the survivor who couldn't live in their house because they experiencing violence in their homes. Also, the government should limit the risk factors which increase gender-based violence, like alcohol consumption. Also, the most be done here in Arabic countries, also in Palestine, change the family laws and justice system response. Like there is no like killing, honor killing. If the father is the killer or the brother is the killer, they don't. The justice doesn't take their way. Also, to provide a psychosocial support for the survivor, to provide, like I said at first, the hotlines, because gender-based violence is survivor is experiencing COVID-19 stress in addition to their situation. And this is for the brief. Thank you so much.
Thank you so much, Noor. And then moving on to the next set of questions. So it's for Barbara. So in your country in NMO, how did the pandemic affect the SORICHAR, specifically talking about menstrual hygiene products that we know it's already a problem in the African region? Do you feel that there are disparities regarding access to menstrual hygiene across the globe? And also, what initiatives do you think governments and NGOs could or should take to help with the lack of access to menstrual hygiene products?
Okay, so for the first question, how did the pandemic affect SRHR? I basically covered that previously, right?
Yeah, specifically about menstrual hygiene products.
Okay, so about menstrual hygiene products, in summary, there was always period poverty in Kenya. It's always been there because according to statistics, like we have 65% of the girls in Kenya, like they cannot afford any of the menstrual hygiene products. So when the pandemic hit, the poverty lines became much worse. And it even apparently the percentages increased to almost around 75 to 80%. However, because research is a bit not so advanced in Africa, I'm not too sure about the sources, but I can assure you that the period poverty has become much, much worse since the pandemic began, because people can no longer afford the menstrual hygiene products. They're being forced to take part in transactional sex to get the products. Prices are increasing, and their parents and guardians lost jobs, so they cannot consider menstrual hygiene management products. Those who cannot be able to access funding to buy the products, they are being forced to use very crude methods that are very dangerous, and they are unhygienic. And it's predisposing them to infections like reproductive health infections. So in generally, that is the issue in Kenya. Yes. So do I feel if there are any disparities regarding access to menstrual hygiene across the globe? Well, I do feel there's a lot of disparities. And even when I was studying about it in our training for menstrual hygiene management in my NMO, I actually realized that menstrual hygiene is generally an issue in the whole world. There's no part of, at least all regions, there are some countries in every region that are affected. I can't say that there is no country that doesn't have it, because surprisingly, even you look at a country like UK, I always thought UK and US as the powerful, superpowers of the world. They don't have it. But it's actually shocking when I realized that in UK, 1 in every 10 girls misses out on a few days in school because they cannot afford it. Even in countries, even in US, because the poverty line is very many millions of people are poor. You find that even in US, 1 in every 5 can miss out of school because they cannot afford the products, because they're too poor to afford it. And when you look at, for example, UK, they have something called a tampon tax. I'm not so sure what it is, but if I remember being explained to properly, it's like a tax added on top of menstrual hygiene products, meaning that it is, I don't know how to explain it, but it's just more expensive because you have to pay a part of it to the government. And it's about 20% of parents find it very hard to afford the menstrual hygiene products. In Africa, of course, generally in the rest of the region, we have a lot of issues. Let me just read a few statistics, and maybe it will seem a bit clearer. So in financial expenses, the cost of purchasing sanitary products every month is a significant struggle for many women across both high and low resource settings. Around the world, it's estimated 1 in 10 young women has been unable to afford protection for their period. 12% have been forced to improvise with devices that may be ineffective, unhygienic, and unsafe. In Africa, 1 in 10 girls miss school because they don't have access to sanitary products or because they aren't safe. They don't have safe private toilets to use in school. In Kenya, 65% of school-age girls do not have access to sanitary products. In India, approximately 12% of its 355 million menstruating women cannot afford period products. So Gabby Edlin also reveals how period poverty affects people in Bangladesh. In her book, It's Only Blood, she explains how there are millions of menstruating textile workers who have to resort to putting a fistful of jute down their pants, small leftover pieces of fabric that end up on the floor of factories. Worse still, they have to wash these cloths with dirty water and without soap, putting their health at risk. This is because pads are seen as a luxury product in Bangladesh, something that the rich can treat themselves to and not a necessity for someone who menstruates. The prices of pads are therefore above what a laborer can afford, forcing them to resort to the unthinkable. In the European Union, sanitary products are regulated and taxed as luxury items. This 5% so-called tampon tax is a burden on household incomes. Past studies report that a fifth of UK parents have struggled to afford sanitary protection for their daughters. According to Plan International UK, 1 in 10 females cannot afford to buy menstrual products in the United Kingdom. An additional survey taken by grassroots group Women for Independence found that 1 in 5 women have experienced period poverty in Scotland. Beyond the immediate inconvenience, discomfort, and expenditure, the high financial cost of MHM can expose women and girls to physical, sexual, and reproductive risk, as reported in a study from rural and marginalized areas in Kenya. Some girls are even trading sex for pads and tampons. 2 out of every 3 pad users in rural Kenya receive their products from sexual partners. When this happens, there's transmission of STIs and HIV and AIDS, and there's an increase in the number of teenage pregnancies and school dropouts. And according to statistics, only 2% of those who become pregnant actually continue with their education. So, but on the bright side, in response to the period poverty, we have countries like India, Australia, Kenya, and Canada, and Ireland, and they've who have gotten rid of the taxes typically added on to sanitary products. In the US, we have 10 states that don't tax feminine hygiene products. In as much as this isn't so much, it's a step in the right direction, and maybe in the coming years, many more countries will follow suit in removing the tax for MHM products. So in general, I've given you a view of countries in many parts of the many regions, and you can see it's generally a problem, not just in developing, but also in developed countries. So I hope that was an elaborate answer to the first question. And now we go to the next one. What initiatives do you think governments and NGOs could or should take to help with the lack of access to menstrual hygiene management products? So let's start with the government. Personally, I think every single government in every single country in this world should work on implementing or making a policy with a targeted a targeted plan on how to combat menstrual period poverty. And in addition to that, how they're going to disperse menstrual hygiene education to every single girl, especially among the school-going girls. Because I've noticed even if you do give the menstrual hygiene products, there's still fear of using them because of maybe the thoughts, myths, and misconceptions that the girls may have. And also providing the products doesn't always solve the problem. Like the government needs to ensure there's MHM education and it's incorporated in the curriculum, and they need to have a proper plan on how to avail products free of charge to all school-going girls. And there needs to be education also so that the stigma can reduce and so that women can freely express themselves and they do not have to feel ashamed about something they cannot control. Yes. Another thing I think that governments should do is this issue of value-added tax on the products should be removed, because majority of the people cannot afford much, leave alone menstrual hygiene products. The least they could do is to at least remove tax on necessities like menstrual hygiene, because it's not something that we as women can control. As for NGOs, I feel that they should just train and they should advocate for these policies to be implemented by the governments. And they can also be the source, they can be the advocates that spread information, and they can even be the people who go out into the community to spread awareness concerning these things. They can complement the efforts of the government. And lastly, for us, as individuals, I feel like we should try and begin normalizing period talk. Yes. So that's generally what I think that governments and NGOs should do. Yeah.
Thank you so much, Barbara, for sharing your overview with us and all the work that you've been doing and these amazing statistics from all over the world. Finally, we finish up with Jose. So the question would be, how did the UNFPA respond to the SRHR service fallout in terms of accessibility, availability, and affordability, both on a global level and country-specific responses? And what do you think the role of young people engaging in the COVID-19 response?
Thank you, Hisham. As I said, I already shared with all of you the link to the technical briefs that we developed for, to respond to the COVID-19 pandemic from the adolescents and youth perspective. So you will see that, we have guidance, we have a Q&A that we work together with WHO and other UN agencies related to COVID-19 and also, around sexuality itself, another, guidance around ASRHR, around out-of-school CSE, around child marriage and adolescent girls programming, but also including, how we can reach, young people living in remote areas. Because, we have been part of this joint campaign using the Prezi platform called Youth Against COVID-19, that you are part of this also, global effort with different youth networks around the world. But, just starting these campaigns, we were, really aware that, not all young people, as has been said here today, has access to, have access to internet or, all the technology. So how we can be, also sensitive and responsive to the needs of young people. So in terms of, services, UNFPA has been, as is supporting governments, but also, civil society organizations. As since the beginning of the pandemic, UNFPA has been supporting, governments also to have, all these dignity kits that are including, menstrual health products, but also, hygiene items for, women around the world. And also, supporting services and making sure that, also the facilities are able to respond to ASRHR and, sexual and reproductive health services broadly, because, also we know that with the disruption of services, all this care around sexuality and sexual health and reproductive health is not necessarily at the forefront of priorities. So, when you have, few hospitals, for instance, now they are, just taking care of all the COVID patients and not necessarily having the conditions to respond to the needs. So UNFPA has been, providing guidance at the global level, but also at the regional level, taking part of all the conversations around, investments and, how countries are able to respond to the necessities to the people on the ground, and also, to take care of, pregnant women, but also the prevention, as I have been sharing. So we have, like all these, global guidance, but also supporting, in country efforts, through civil society organizations, but also governments, but also, with other UN agencies, coordinating clusters and also, being responsive along the way, as also, has been shared here, by our other speaker, from Palestine. So, and in terms of what is the role of young people engaging in the COVID response, I think the best example I can share with you is this campaign that we have been working together with, with you as medical students around COVID-19. We prepared together 6 scripts and videos for young people to engage and, also make their voices heard around, from what's COVID and all, the information that is needed based on evidence till mental health, including, sexual health. I think we started talking about sexual health during COVID, even before, having some precise guidance even from WHO. I think this is a big achievement. And, I think young people has a very important role to play in terms of uh, risk communication and community engagement, and also, how we can battle against, all this infodemic, as we have been, reflecting here today. There is an important role. We have the experience of, young people working in different countries, for instance, having platforms to say, this is a fake news, this is not accurate, uh, this is misleading information. This is a complete, an important role that is feasible to do. There is an important role as well in terms of, uh, intergenerational solidarity. How young people can, also be responsive to the specific needs of young people, but also, supporting people that are most in need. So I think we have been working hand in hand with youth organizations, and now there is another layer or another step of the campaign calling for, challenging young people to talk about, what's the new normal that we would like to see, how the new normal should look like in terms of, reimagining a society that need to come back better, as we have been, saying. So I think there is a lot of opportunities, but also we have to consider that young people is, also facing a lot of challenges in terms of mental health, lack of, employment, and lots of challenges that often are not necessarily, taking into consideration the specific needs and rights, but also, the role that young people can have, along this pandemic and also in the recovery phase. Thank you.
Thank you so much, Jose, for finishing up with this round of questions and for sharing your knowledge and your work with us. So just moving on for one last Q&A. So if we could take one question, that would be great. Because we are over time, so I would not like to go more than that. So if someone has one question that they would like to ask our externals, go ahead, raise your hand or type it down in the chat box.
I want to say something.
Mm-hmm.
I want to apologize for losing connection because we have electricity problem here in Palestine. For the last section, I have not answered, but if you realize we have reached the last section about what we will take to the next generation.
Mm-hmm.
So I want to add that for my experience, advocate. I remember my first webinar as a national officer here in Palestine. Rose HD told me that if you want to do something or change things in this world, you have to advocate, then advocate, then advocate. Knowledge is a power you will never imagine or understand how much can change in the world. So advocate. And I want to say something also. Nothing can stop us from doing more, giving more. Even August meeting here, we have managed to do it virtually. We couldn't meet each other, but nothing stopped IFMSA from doing General Assembly. Also, I want to mention the last thing. Technology has stepped into the breach and will continue to play an important role in our life. So advocate for SHRH. And if your animal complete advocating and continue advocating for SHRH, you will notice and touch the change in your community, the people around you. And I touched this when I started to advocating about sexual harassment, about child abuse. I see knowledge, I see how much they have the brave to talk about sexual harassment. Before being a Nora, before talking about these topics, no one can talk about sexual harassment. Now they can talk, they can advocate for the problem. So advocate, advocate, advocate. Thank you.
Thank you, Noor, for these last words. If one of the other speakers want to has any last words before we close, please feel free to take the mic.
Well, I just want to say thank you, and recognize your role as medical students to also recognize and understand health beyond the clinic service, right? And how this is related to collective health, to politics, to activism, to human rights, and this is great. So I'm very grateful to be part of this conversation with you all, and we are open and happy to continue and working with you. And also, to share this space with, these great speakers. Thank you.
Thank you so much.
Can I say something?
Yes.
Okay. So I just wanted to tell everybody that I know that most of the conversations have been us partnering with big organizations or doing big things, but I just wanted to tell anyone out there that no matter how small you think you may be, there's something you can do in this pandemic. It's really affected people badly, and you don't have to go and impact thousands of people so that you can be known as a superhero. No, you just have to go help out that neighbor who probably is being beaten up and needs help. It's as much as maybe giving some money so that your neighbor's daughter can have some menstrual hygiene products. It can start from the smallest of the small. And at this point, because of how this pandemic has affected almost the whole world, literally, and it's affected so many people, there's so much that you can do even at a local level. And lastly, I'd also like to thank the SCORA IT for giving me this opportunity. It is amazing, and I would have never imagined to speak in such a panel. I've learned so much personally, and I hope that there's something you've learned and picked from me. Yes. Thank you so much for listening to me, and I'm honored, humbled, and it's been amazing interacting with all of you, Cecilia, Noor, and Jose. It's just been great. Thank you so much.
Thank you, Barbara, for being with us today. Cecilia, if you'd like to say a few words.
Yeah, no, thank you very much. And I definitely learned a lot from Barbara and from others, from Nora and Jose. So thank you for sharing your experience and also the work that you're doing. And as I want to use Nora's words to close, it's just I remember to advocate, because that's what we need to do, is to continue highlighting these issues. Wherever we are working, it can be in our own country, in our own association, also at the national level or the international level. But there's a lot that affects our lives as women, as young people, as LGBT people, as any other intersecting identities that we may have, that we are being affected by COVID-19, or even in our life before and obviously after COVID. So I think that we need to continue seeing what are the issues that are affecting access to information, education, and services to SRHR. And remember that these are important, essential aspects of everyone's life, and this is why we need to continue working to make sure that we all can make the decisions that we want in our life and have the services that we need. So thank you for the invitation, and thank you everyone for organizing this session.
Can I ask for something, Hisham?
Yeah, go ahead, Egle.
I want just to take a picture for all of the participants of that because it's my first experience. It's wonderful. I want to thank all of you to giving this opportunity for me. It's mean a lot. So I want to take a picture to be a memory. So can I have one?
If we can give the floor to Egle, and she's actually gonna mention that as well, so we can just close and then take the picture. So Egle, floor on to you.
Thank you. I was waiting for the floor, and finally that I have it. If everyone is okay, we'll be taking a picture. If you do not consent to the picture, you can turn off your camera, but in general, I encourage you to turn on your camera. And I will be taking 3 pictures to try to fit in everyone, okay? So do your best smile right now. I must say it's hard to smile and take pictures at the same time. With this, I would like to close and thank you so much for all the speakers and for your amazing insights. It was truly an absolute honor to have you here in the SCORA sessions. Hopefully we can meet the next time in real life for the March meeting. And that was all for this day. Thank you also for our participants. You will find in your emails the feedback form that we encourage you to fill. And once again, thank you so much for everyone. Also Hisham for great moderation. And we will hope you to see you here also for the next days of SCORA sessions.
Have a very, very nice evening, night.
Thank you.
Bye, everyone.
Thank you, everyone. Bye.
Thank you.
Bye. Thanks, guys. Thank you. Bye.
Bye. Thank you.